everyone, welcome back to our Fire Nursing tutorial YouTube channel. In this class, we are going to discuss MCQs. Who all have visited first time on this channel, do subscribe and watch. See the first question. Vaccine with maximum efficacies. Options are here. Measles. Next question. The risk of cold chain failure is greatest at sub-center and village level. Next question. A clinic nurse prepares to administer an MMR vaccine to a 5-year-old. The nurse administers this vaccine for that is subcutaneously in the outer aspect of the upper arm. Next question. All of the following are the role of community nurse in school health program except to provide immunization to the children. Next question. Frozen DPT vaccine should be discarded. Next question. Which of the following vaccine is most sensitive to heat? Polio vaccine. Next question. Universal immunization program was launched in the year 1985. Next question. What reaction might occur due to tetanus vaccine? Brachial neuritis. Next question. Smallpox vaccine was invented by Edward Jenner. Next question. Global program of immunization started on 1974. Next question. In which of the following year umbrella program started? 2005. Next question. Administration of ready-made antibodies creates that is passive acquired immunity. Next question. Outbreak of disease in community in excess, the normal expectation is epidemic. Next question. Sporadic means right option is C, that is disease occurs at irregular intervals or only in few places, scattered or isolated manner. Next question. Outbreak of disease in bird population is epidemic. Next question. The continuous systemic collection, analysis and interpretation of health related data needed for the planning, implementation and evaluation of public health practice is known as surveillance. Next question. Number of current cases at a specific point in time divided by population at the same specified point in time is referred as point prevalence. Next question. Which of the following is the most logical sequence? Disease, impairment, disability, handicap. Next question. MMR is a ratio. In which of the following is most important health indicator of health services in any country? That is IMR. Next question. In which of the following state have highest MMR? Assam. Prevention of risk factors related to a disease condition is known as primordial prevention. In the prevention of communicable disease, primary prevention results from Immunization. Pap smear screening is an example of. Secondary prevention. Which of the following is not an example of primary prevention? Smoking cessation. When you immunize a child for measles, what type of prevention you are doing? Specific protection. Monitoring of blood pressure in which level prevention? Secondary prevention. A community health nursing is providing health education to diabetic regarding how to self-monitor blood glucose level. Which of the following level of prevention? Tertiary prevention. A patient has a PPD skin test. As the nurse, you tell the patient to report back to the office in dash so the results can be interpreted. 48 to 72 hours. Please like, share and subscribe to my YouTube channel for more useful content. Thank you for watching.